Okay, so for those of you who have a green strength band, that is indicative of a squat deficiency. So you'll find in the fitness center that we have some corrective pictures for all the different bands. So take a look at that when you get a moment. But if you do have a green band, we want to try to determine if it's a patterning thing or if it's your ankle that is causing the issue, your ankle mobility. So one good way to test your ankle mobility is to put your toe at about 4 inches from the wall and then bring your knee as close as you can to the wall, hopefully touching. So we're going to use me as a test subject on this because my squat is not very good because I have some limitations that I will never overcome. About 15 years ago, I ruptured my Achilles tendon, so I have about a 10-inch scar that shows I had surgery. So if we look at my good leg, put my toe at 4 inches, bring my knee to the wall, you can see that my heel does not raise. That's got adequate mobility. If I put my other foot in that position with the 4 inches and I bring my knee to the wall, notice how my heel is on the ground and my knee is about a full 1.5 inches away from the wall. If I bring my knee to the wall, my heel goes up off the ground. So my ankle mobility of my right leg is a problem and it will manifest itself in a squat. So identify whether you have ankle mobility issues. If you do have ankle mobility issues, we want to make sure that you're using the stick around those soft tissue of the ankle as well as the golf ball on the bottom of your feet. And also you need to work on those things that I reviewed for the golf ball, like the passive and active ankle mobility exercises. There are a few other things that you can do that might provide a solution. You can do some ankle mobility with a dowel. Position your foot in a half kneeling position. The dowel is going to sit on the outside of your foot, knees on the outside of the dowel, and you're just going to drive forward, keeping your heel on the ground. You can do some repetitions like that, trying to give a good stretch. My preference for this exercise is actually to have a client sit on a stability ball, drive your heel into the base of the stability ball, and then roll your body forward. That's going to provide a pretty intense stretch of that area. Two other exercises that might be beneficial. One which is patterning, and the other which is what we call RNT. So the patterning could be done by grabbing a hold of an object, keeping a neutral spine, squat stance, and just pattern a deep squat. You can kind of stay down there at the bottom, rotate back and forth, chest up. That's just patterning your deep squat. Another exercise you might find a lot of coaches encouraging you to do is using an RNT technique for your squat. Attach a band to a point on a stable attachment. Position a cook band in your shoulders. And now you've got your squat pattern. So hopefully those exercises, that if you could start doing those on your own, will provide a solution to help you move better during a squat so that you're safer and your workouts are more effective.